Hello again. Just now we are going our virtual congress. This presentation is going to be from BIOMATSEN Congress. It's one of the pre-recording, and we are watching Professor Thomas J. Webster's presentation from Northeastern University, USA. The title is Are Better Medical Devices Enough to Improve Healthcare?
Hi, and this is Tom Webster from Northeastern University. I'd like to thank you for logging on and listening to what I have to say. And thank you very much to the conference organizers for this invitation to give a plenary talk. So what I wanted to talk about, of course, the original idea was to discuss implantable sensors, how we are using implantable sensors to improve medicine, but I think I would be remiss if I did not talk about COVID-19 since this is on everybody's mind. So I planned a presentation that will talk about how nanomedicine is being used both for COVID-19 as well as implantable sensors. Of course, I do need to state to you I have a financial interest in some of the material to be presented in this presentation since I start a lot of companies who end up getting FDA approval for implants, etc. So here are some of those companies that I've been involved with that I will present research here. So let's start with COVID-19. Clearly, this is something that has impacted this conference. I applaud the conference organizers for continuing despite the fact that we can't meet in person. It is always great to get together to talk about science, to keep our community alive and active. And you might not know that nanomaterials are being used and tested and researched widely for COVID-19, whether it's prevention, diagnostics, or therapy. Nanomaterials are actually seeing widespread use. So I want to cover some of those examples for you here. But before doing that, let's first think about how did we get here? How did we get to a situation where universities are closing, schools are closing, everything seems to have moved online, where we can only gather in groups of 10 or less, where we need to have testing, repeated testing to determine if we continue to be negative or if we're positive, to be quarantined, where we've had so many people die from COVID-19. How did we get here? And something I've been talking about a lot through the years, throughout my 25-year career, and I know other people have been talking about this as well, are problems in our global healthcare system. And I don't want to be too critical, as healthcare has improved the quality of life of millions throughout the years. But I think COVID-19 has really highlighted some persistent problems in our healthcare system, no matter where you are on the earth, that we really need solutions for now. And we needed solutions for them years ago. So clearly a big problem with our healthcare system is COVID-19, but it goes beyond that. It goes beyond dealing with pandemics. We have overcrowded hospitals that COVID-19 has clearly highlighted, where we need to build temporary hospitals just to deal with the number of infected patients. Here in the US, there have been studies showing that now we have barriers to get people to even come into the hospital to get testing or to get a traditional healthcare problem examined. For example, the number of patients going in to a hospital for simple cardiovascular problems or for diabetes, where we have treatments, has gone way down. So clearly there's a number of barriers that exist today that people don't even want to go into a hospital or doctor's office for fear of catching COVID-19 or some other disease. We, of course, have medical devices that don't last the lifetime of a patient. A hip implant that has an average lifetime of 20 years before it fails. We have an overdependency on drugs to fix everything. In fact, one of the common things for COVID-19 that immediately people were saying when it became a pandemic is, oh, well, let's just wait for a vaccine. Well, guess what? We're still waiting for that vaccine. We're still waiting for therapies, drug therapies. So we have an overdependence on drugs to fix everything in our healthcare system that I think has embedded in it a number of problems. In general, we treat every patient the same in our healthcare system, yet we know from COVID, as just one example, that symptoms vary greatly from person to person. We know this is true also for a titanium hip implant, that your reaction to that hip implant can be vastly different than your neighbor or than someone else in your family. So we have to get beyond treating every patient the same. We also know, as I've highlighted on this list, that our medicine is mostly reactionary. And that is what has caused such a big problem in COVID-19. You have to come in for a test. Are you positive? And that enables our healthcare system to react to you. We have to do a much better job of predicting healthcare problems, whether it's for a virus pandemic or whatever the situation is, to enable our healthcare system to be much more efficient. And we could go on and spend my next 35 minutes talking about all of the problems in our healthcare system. But I think it's clear in many different diseases, especially a virus pandemic, that we should have been better prepared. And we should have known that we have an emergence of viral pandemics that are occurring almost every year in the earth. We are well aware of Zika, MERS, Middle Eastern Respiratory Syndrome, norovirus. These are all very common viruses that we've gotten to know quite well through the years that have really turned our healthcare system on its head. And there will be another virus problem coming up that right now I don't see us prepared for. And in terms of viruses, again, I think we have to get beyond this wishing and praying for a vaccine, but we need platform technologies. And I happen to think nanomaterials might be that platform technology that can be modified in a simple way for every new virus. Another emerging problem that I don't think we're prepared for are bacteria. You might know that places like the CDC here in the US or other think agencies around the world have predicted a huge problem for antibacterial, antibiotic resistant bacteria. In fact, this chart on this slide shows in purple that the CDC has predicted more people will die from antimicrobial, antibiotic resistant infections, bacteria infections, than all cancers combined by 2050. This is alarming. And it comes from the fact that we traditionally have looked at antibiotics to kill bacteria. We have traditionally looked for vaccines to stop viral spread. But those approaches aren't working anymore. And I think it's clear to see, obviously, with COVID-19, how waiting for a virus is not a smart approach, but also in the bacteria world, waiting for this new development of an antibiotic that can kill an antibiotic-resistant bacteria like MRSA. That is not working. In fact, here's a list of all the antibiotics that have been developed, some of the antibiotics, excuse me, that have been developed since the 1930s. And yes, streptomycin, penicillin have really helped our healthcare system, but bacteria are now resistant to all of these. Some bacteria are resistant to all of these antibiotics. In fact, the FDA here in the US has all but slowed down approval of new antibiotics. And really the reason is because new antibiotics that receive approval from the FDA need to demonstrate that they won't result in resistance in bacteria, therefore creating a brand new problem for us to treat. So many of us, many years ago, we've seen these problems on the horizon. We've seen viral infections be huge issues. We've seen bacteria infections, the emergence of antibiotic resistant bacteria. So we looked at this new classification of materials, nanomaterials. And in my personal history, I started this research about 25 years ago as a PhD student to look at small materials, nanomaterials, and how can they be used to kill a bacteria? How can they be used to disrupt the function of a virus? So to me, and what I wanted to start in this presentation is that it really makes perfect sense to look at nanomaterials, nanoparticles to prevent COVID or to diagnose if you have SARS-CoV-2 or the virus responsible for COVID-19. And of course, we think nanomaterials can be used as therapy for COVID-19. So why? Why should we really think of changing and promoting the use of these platform materials, nanoparticles, to treat, in this particular case, viruses? And there are many reasons, and they're all quite obvious to me, and it's not rocket science that we need a new approach, and that new approach could be a nanomaterial. So here's some updated statistics from today when I'm videotaping this presentation of CNN. This is not going away, and we should not be fooled. We see many sporting events starting up again. We see people at auditoriums or people in sporting events. And you might get the sense that these COVID-19 problems are going away, but they're not. In fact, I think a lot of us just look at universities that have opened their doors in August and now have closed their doors and gone completely online. That should show you alone that we are not winning this strategy against COVID-19. But when we look at possible solutions, and again, I'm a big proponent of developing a platform technology that can be modified for every new virus that comes along, including COVID-19. We know that SARS-CoV-2 is nanostructured. All viruses are nanostructured. Here's, a simple cartoon of SARS-CoV-2, which we all remember seeing pictures and can see here in a picture of this too, the S protein that is on the virus. This attaches to a mammalian cell, enables it to get into a mammalian cell to replicate. So clearly we know that S protein is a key target for blocking if you want to keep a virus from replicating. But it's not the only spot that you should target. And the reason is because viruses mutate all the time. And a lot of mutations occur in these S proteins. So if your whole strategy is to go after developing a material to block the S protein attachment to a mammalian cell to enter to replicate, a simple mutation will render your approach useless. That's why another key part to SARS-CoV-2 and all viruses is that they have multiple nanostructured functionalities that you can target with your approach. Again, looking at this cartoon, there are nuclear proteins N, there are envelope proteins E, membrane proteins M. In my mind, the best strategy is to go after multiple attachment sites on a virus so that in the case a mutation occurs, your platform technology can work in the future. We also know that viruses have a limited ability to withstand heat, just like all proteins. So if you can increase localized heat, which nanoparticles can, you can disrupt function and keep the virus from attaching to a mammalian cell and replicating. And we also know that viruses have a lipid membrane which can be disrupted through reactive oxygen species. Nanoparticles have been studied for decades to treat cancer, to produce reactive oxygen species to kill a cancer cell. So if you can generate reactive oxygen species, you could potentially disrupt this membrane, lipid membrane, and render, again, that virus deactivated. So a couple of more examples, sorry about my slides here, of why we should think about using nanomaterials in particular as antiviral materials. And I draw your attention to their novel properties. We've known for decades that nanoparticles, because of their high surface area to volume ratio, their orders of magnitude higher amount of surface area, have special properties. They have special photothermal properties. So I happen to have some gold nanoparticles right here that can be activated using near infrared to heat up, to cause that virus to disrupt its structure and inactivate it. The unique photothermal properties of gold nanoparticles, again, are due to their high volume to surface area. We also know nanomaterials have unique optical properties, like what I just described for near infrared. They have unique electrical properties, which I'll talk about when thinking about sensors. Unique magnetic properties. We all know about iron oxide nanoparticles, and here I have some right here that can be activated by a magnet. Here's a magnet, again, showing you how easily it is to get magnetic nanoparticles, because of their high surface area to volume ratio, to be controlled and attach to diseased tissues or diseased cells. Of course, these magnetic nanoparticles are very useful in diagnostics, where you can get the magnetic nanoparticle to attach to SARS-CoV-2 and then use a magnet to consolidate that virus so that it's easier to detect. And the list goes on and on. Let me just show you one other nanoparticle that we are very interested in, and it sort of looks like milk, but it's cerium oxide. Cerium oxide, which I have a couple of SEM pictures here, are very interesting for treating viruses because they change their ability to accumulate or give off reactive oxygen species based on pH. And a viral infection is acidic. So we have been developing these kinds of cerium oxide nanoparticles, ceria nanoparticles, to not only respond and produce reactive oxygen species to kill that virus, but you can also now create cerium oxide nanoparticles to have these multifaceted regions that can fit very nicely in between the S proteins of SARS-CoV-2. And that's important because you can now create these nanoparticles to fit in between nano regions of a virus to make that attachment strength stronger and do more damage to the virus. So other reasons for using nanoparticles: they're easily aerosolized. And as we know, COVID-19 strikes your lungs. So if you have a nanoparticle that's easy aerosolized, you can use an inhaler to get those particles to that part of the lung for maximum treatment. They're easily functionalized. We have over, I probably would guess, 3 decades at least of chemistry that can be used to functionalize nanoparticles to attach to regions of viruses, multiple regions of viruses. The third bullet, we also are now making nanoparticles out of common nutrients. I showed you iron. Iron is great for your immune system. So as it's killing the virus and degrading, it can boost your immune system. But here's another one, selenium. There you can see some agglomerated selenium nanoparticles on this, in this container that I have. Selenium is also part of your diet and can be instrumental in creating reactive oxygen species to disrupt a virus. So you can make them out of dietary elements that are biodegradable. Of course, as I mentioned, you can use external methods to heat up these nanoparticles, especially gold as an example, and so many more wonderful properties of these nanoparticles, which make them useful for fighting COVID-19. So I don't have a lot of time to go through some of these examples, but nanoparticles are being used for prevention of COVID-19. Nanoparticles are being added to masks, in which the mask can trap COVID-19 if you happen to be coughing or it breathes out. When the virus comes out, it's with a liquid container, so that liquid can spark, so to speak, initiate the nanoparticles, zinc, silver, copper, magnesium, to produce reactive oxygen species. So your mask can not only increase capture of the virus when using nanoparticles, but it can also deactivate it more readily than without these nanoparticles. We also have seen people make everyday surfaces resistant to COVID-19 through the use of nanoparticles. And again, one simple example is using these selenium nanoparticles as a spray on aluminum. You can see two SEM pictures here in the upper right, uncoated aluminum, nano-selenium coated aluminum. Aluminum is used in a lot of everyday products where, again, that selenium, if COVID-19 happens to attach or the virus happens to attach, you can use selenium to deactivate it so that if your hand goes across the surface, it won't spread. We are also seeing people use things like TiO2, nanoparticles, which can be activated through UV light. Because of that high surface area of nanoparticles, you can now have a cleaning surface from UV light activation to keep that virus from being active once it's on a surface. Of course, in diagnosis, there's a lot of nanoparticles being used to, again, concentrate a solution, whether it's a point of care device, a diagnostic kit, or a swab that's being used. These nanoparticles can attach to a virus, accumulate, and that allows you to have a concentrated amount of a virus if it's there for easier detection. And lastly is therapy. Therapies have become very popular for using nanomaterials, whether it's self-assembled chemistries like what's pictured here on this slide, in which the self-assembled chemistry wraps around the virus like a blanket to, again, keep it from being active to attach to a cell membrane. All of these are showing a lot of promise, but probably one of the biggest success stories for nanomedicine so far, it's still in clinical trials, is the vaccine being developed by Moderna here in the US, in Cambridge, Massachusetts. They are using a lipid nanoparticle capsule for all of the reasons that I mentioned, these unique properties of nanomaterials, avoiding immune system clearance so that they can inactivate your immune system to fight against this vaccine. Moderna has really been kind of the champion of using nanomedicine for COVID-19. So it's being commercialized and being used in many different aspects. But before moving on to my sensor part of my presentation, I do want to mention this. You know, many people, when they think of nanomedicine, they only think of nanoparticles. And yes, these nanoparticles are wonderful, nanoparticles of iron oxide, and are showing a lot of promise for COVID-19, but there's also nano-textured surfaces that are showing a lot of promise across all of medicine, whether it's to reduce bacteria and virus attachment to surfaces, or whether it's simply used to promote tissue growth through the use of nanotexturing. And here you see a couple of examples of where I've been involved in work that has gone to the FDA, where we can create nanotextures on spinal implants. These nanotextures on spinal implants reduce inflammation, reduce bacteria attachment, and promote bone growth, all without using a drug. And drugs have been great, pharmaceutical agents. I have many friends in pharmacy, but you have to keep in mind, if you're using a drug, there will be other unintended side effects of that drug. So wouldn't it be great to be able to reduce infection, to reduce inflammation or scar tissue growth, to promote bone growth without using a drug and using these nanotextures alone? We also have experience improving amputee devices. This is obviously a rat study we did where we used a screw for an amputee. That femur's been amputated. That screw can have nanostructured features, as shown here, to increase wound closure. That stabilizes the implant, keeps bacteria out, and provides for a better amputee device. We've also been using nanotextures for vascular applications. So if you're regenerating an artery or using a stent to prop open a blood vessel, these nanotextures can increase endothelial cell coverage, which improves function of that device, avoids inflammation of those materials. Catheters for antibacterial applications that have nanotextures that resemble those of insect wings can reduce bacteria colonization without using an antibiotic and without contributing to the antibiotic resistant emergence that we have coming up. And the list goes on and on. We've also used nanotextures on implants to improve ligament attachment, tendon attachment. So for all those people that have torn your ACL, we're developing nanotextures that can grow a tendon off of that metal for better fixation than what's been done today. And biodegradable metals like magnesium oxide can be nanotextured to improve cell function as well. And we have spent a lot of time in my lab looking at the fundamental reason of why these nanotextures work in medicine, that not just my group is showing, but a lot of groups are showing how these nanotextures can really help. And the reasons can go from simply mimicking nature. So this insect wing that has a nanotextured feature, that is a mimicking nature. And the value of this is that bacteria don't grow on insect wings. So you borrow that and use that in your medical device technology to reduce bacteria attachment in the body. But the explanations can be much more sophisticated than that. Looking at biophysical models of how these nanotextures can adapt or not adapt to the membrane stiffness in bacteria. And what we've seen in our computational modeling is that the bacteria membrane is not flexible enough to fit in each of these contours, but a mammalian cell, which is much more flexible in terms of its membrane properties and much larger, 50 microns as opposed to 1 for bacteria, they can begin to fit, and they prefer the 3D interaction that occurs with nanotextures. We've also looked a lot at protein interaction and how nanotextures can change the bioactivity of proteins like fibronectin, shown here to be more fibrillar as opposed to the globular non-bioactive form that occurs when fibronectin adsorbs on micron surfaces. And I don't have time to talk about this, but we've even created an equation that could predict the height, the width, the length of a nano feature to put on your surface, on your material, that can actually promote tissue growth, keep bacteria from attaching, keep viruses from attaching. So now I'd like to really transition to sensors and think about how sensors are being used in medicine. And of course, we have been very interested in transitioning to sensors. And I don't mean sensors that you put on your body, but sensors in your body, because that's where more information is about your health. So what we've been trying to do in the lab is really come up with a challenge for ourselves. To be more proactive in medicine, what do we need to do? And I think, as much as I love these nanotexturing, tissue regeneration, for orthopedic implants to vascular stents, as much as I love that work, I don't see that as the future of our medicine. It's still too reactionary. It still treats every patient the same. We really need sensors in the body that understand your immune system reaction to a material and then modify itself to improve implant success. So really, we go back to this list of problems in our healthcare system. And I think implantable sensors can address all of these, including COVID-19. Obviously having a sensor that can determine in your body if you have COVID-19 symptoms could be revolutionary for sensors. But certainly implantable sensors can reduce crowds in hospitals because we're bringing the hospital to you. It can reduce the barrier for you to go to your doctor because you now have a mini doctor in your body that can determine if you're healthy or not, and so on and so on. So here's one of two examples that I'm going to give you on how we are developing implantable sensors to be this paradigm shift in medicine. And the first one we call the smart hip. And this is really, we take off the shelf hip implants and we grow carbon nanotube sensors off of the surface. These carbon nanotubes can electrically sense what cell and what tissue is growing on the surface. We then have embedded into this sensor radio frequency technology that can send that information to a handheld device to say, yes, we have measured 1,000 MRSA or bacteria on your implant, or, you know, everything looks like it's going fine. Continue your exercise regime, bone is growing well. The third part of our sensor, so we have detection, message sent to a handheld device, and then the third part is how do you react if this implant is not working? And we've developed a biodegradable polymer that is conductive and can release antibiotics, anti-inflammatory agents, pro-bone growing agents, painkillers on demand through electrically degrading that polymer. So we have what we think is kind of a complete system where you can respond to problems that you're measuring. So I want to share just a very quick in vivo study with you where we looked at the efficacy of these sensors. We, of course, grew our sensors off of titanium, implanted them into the skulls of rats, and we forced an infection. So we seeded bacteria onto the sensor and then implanted it. We used 10 to the 5 colony forming units of Staphylococcus epidermidis, a major bacteria that infects orthopedic implants today, because this is the bacteria on your skin that you can't get rid of before a surgery. We then used traditional methods to determine if bacteria were present after certain periods of time, and we used our sensor to determine if bacteria was still present. So we use cyclic voltammetry in this analysis, and as you know, when growing carbon nanotubes off of titanium, we anodize the titanium first to create pores and then grow carbon nanotubes out of those pores. When adding carbon nanotubes to that anodized titanium, that's when you get a sensor. And so if you know anything about cyclic voltammetry, you know you look for redox peaks, reduction oxidation peaks. The position of those peaks are only apparent when you have carbon nanotubes present. As you can see, the plain titanium, anodized titanium doesn't have those peaks. The position of these redox peaks tell us whether it's bone that's growing, or is it infection, or is it inflammation. We can also look at the area under the curve of these cyclic voltammograms to tell us how much of that tissue is growing. So we have a formula that converts this signal into the amount of bone growth. Here it's just shown for calcium deposition that can show you that you're getting bone growth and whether it's increasing with time. But let me show you this last slide, which really amplifies and I guess exemplifies this purpose of doing this sensor. Again, remember, we added bacteria to the sensor and then implanted it into the rat. On the left image is our control. This is what we did. We did not have a sensor. We did not release any drug once we measured for whether bacteria were present. And you can see in yellow is a positive stain for bacteria. The control had bacteria, obviously, after 7 days because we didn't use anything to kill it. In contrast, our sensor measured bacteria presence, and we then used our electric field to release gentamicin on demand to kill that bacteria, to kill the Staphylococcus epidermidis. Then we follow that with the release of BMP7, that's a bone growth factor. And you can see in the histology slide, no signs of bacteria, only signs for bone growth. Increased push-out strengths were measured, again, highlighting the importance of this sensor to on-demand control infection and get rid of it. So let me also tell you a question we got from an orthopedic surgeon about our sensor, which was, can you tell me if an antibiotic I'm prescribing is working? And the reason for that is the orthopedic surgeon, like all surgeons, are basically guessing what type of bacteria are present surrounding your implant. They don't know for sure. And this could be one of the reasons why, medicine has really contributed to the growing problem of antibiotic resistant bacteria. So we conducted a study in which, again, we forced bacteria onto our implant. Here we did Staphylococcus aureus. We then added methicillin in 3 doses. So every 4 hours we added methicillin, and you can see the shape of our cyclic voltammogram curve changed. It went from 24 hours, the initial bacteria, large area under the curve, redox peaks indicating that in fact we do have an infection, bacteria, but then we add methicillin, the first 4 hours is in blue, and that shape decreased. The area decreased even more after adding more methicillin, even more after adding more methicillin. So the area under the curve shrunk, so we were able to tell the surgeon, yes, when you were adding methicillin as a prescription, it was actually reducing bacteria presence. Valuable information for the clinician. And I think I have maybe 2 minutes left to give you one more example of a sensor technology that we're pretty proud of. And it's called 4D printing. So if you simply go to this graph on the right, obviously we all know what 3D printing is. And we are developing self-assembled materials that can be 3D printed into a flower, a hand, a body, something for microfluidics, a brain, or heart. What we do to make it 4D, and 4D to us means that these materials can change shape with time due to external stimulation, is we're adding graphene nanoparticles. They're black, so we add them to this printed objects, and you can see the flower, the hand, the body, et cetera, et cetera. Then we use near infrared to excite that implant to start changing shape in a controllable way. So we can make the flower open, we can raise certain fingers in a hand, and we could do this if these materials were inside your body. So the reason why that's attractive for us is it helps control shape of a material that's been implanted into your body. That helps with on-demand drug release for painkillers to avoid the opioid addiction, which has also taken our country and world by storm, because you often have to give overdose of opioids in order to reduce pain. Now you can minimize the dosage and only give it whenever the patient is feeling pain, because you can have on-demand shape control, on-demand drug release. But you can also simply make a material grow or shrink. So not even thinking about drug delivery, this could be very useful for bone growth, where you use a self-assembled material that's been printed with graphene nanoparticles, use near infrared to make it swell. We know bone grows under increased pressure, so you can have an on-demand system that promotes bone growth in regions where it's not occurring. So I'll spare you some of the details, but we've been looking at 2 different self-assembled chemistries to use for 4D printing. Here's the chemistry of one of them, where we originally developed these to kill bacteria. They make fibers that pierce the membrane of MRSA, or multi-drug resistant E. coli. But here's the second example of a chemistry that we're developing if you're interested. Example B, we call these helical rosette nanotubes. Specific chemistry, they'll self-assemble under control in the body. But when we do animal studies, whether it's for bone or cartilage, we fill up those defects with this material. We then allow the 4-dimensionality to take over. And as you can see, in 12 weeks, we can get complete bone regeneration, whereas a control, we don't. Cartilage, same thing, inject these into a defect in cartilage, regrow that cartilage tissue, whereas in controls, we get fibrocartilage. We don't get the real mechanical properties of cartilage. So this really is an up-and-coming area for us to have these materials that can sense their surrounding, respond accordingly, and improve implantable materials. So I leave you with this last question of thinking of how sensors have really revolutionized so many fields: automobile, electronics, smart houses, but not medical devices. We clearly have not begun to see the promise of using implantable sensors in medicine. And I hope that that changes. So hopefully I did a decent job here over the internet of describing to you promises and in the future of nanomedicine for global healthcare, a little bit on COVID-19, a little bit on sensors to really get us out of this thinking that you have to go into an old-fashioned hospital for healthcare. We need these technologies for the next pandemic. We need them for the current pandemic. So I thank you for your attention, your participation. Of course, I need to acknowledge the funding and my lab here in Boston, who's been working hard throughout this whole COVID-19 situation in the lab, trying to develop solutions. Thank you all very much. I appreciate your attention and the invitation for this plenary talk. Thank you.
Yes, also we want to thanks to Professor Thomas Webster for his nice presentation and this very interesting, very global COVID-19 presentation to him. And I want to say that if do you have any question about Professor Webster's presentation, you can send an email to him, as he said that.